I'm Linda Alt from Virginia. I work at Care One, which is a long-term care company. I'm here representing the Virginia Nurses Association, which is part of the Virginia Action Coalition in partnership with AARP. We are seeking membership in our subcommittees across the state because we want all areas of Virginia to be represented, not just the more metropolitan areas. We're also seeking both business leaders, and we have members, lay members that are volunteers with AARP to make sure that we get the consumer input as well. Although all 6 recommendations are priorities, we have been focusing on nurses being able to practice to their full extent of education and training, and I am actually the co-chair for Access to Care in Virginia. Virginia has many rural counties. We have a nurse practitioner in particular. Her name is Kristen. She lives in Dinwiddie County. It's a medically underserved area and has the highest incidence of diabetes and hypertension in the Commonwealth. She leaves Dinwiddie every day to travel to Richmond, where she practices in an academic setting. And while that's a great service to the university, she would prefer to be able to provide primary care in her own community. She's unable to find a physician to supervise her, so we've got a catch-22. She wants to provide and fill a gap in primary care, but is unable to do so because of the supervision requirement. We would like to be able to have assistance removing the CMS barriers to supervision. We've had difficulty removing that same barrier in Virginia, and we feel if it was removed at the national level, it would smooth the pathway to remove it at the state level, allowing the nurse practitioners to practice independently in the underserved areas.